Traveling during the holidays can mean hours on a plane or in a car, but sitting for those extended periods of time could put you at risk for something called deep vein thrombosis. And here to talk about DVT is Dr. Chris Magovern, ABC News medical contributor and cardiac surgeon at Morristown Medical Center. Dr. Magovern, thanks for being with us today.
Great to be here, Dan.
Okay, so what is DVT?
Well, simply put, it's a clot, which we call a thrombus, that occurs in one of the big veins in your leg. Veins are a little different from arteries, and you have to understand that. When your heart pumps blood out of your body through arteries, the blood travels fast. It's unlikely to clot. But when that blood hits the organ that it's going to, it turns around and comes back very, very slowly in the veins. And the blood flow in the veins is a lot slower. And that's the reason, one of the reasons that blood can clot. If you think of your leg, for an example, the veins that carry blood back to your heart in your leg have to fight gravity also. So we rely on the muscles in our legs to squeeze the veins to get the blood back.
Almost to pump the blood back up to the heart.
You don't have a heart down in your leg to pump the blood back up, so you have to rely on your legs.
Okay, so what are some of the symptoms then of DVT?
Well, you may have, if you have a DVT in your leg, you may have a tender leg. It may be red, it may be blue, it may be warm, but the two things that you're going to notice is that, number one, it's swollen. It's always swollen, and it's almost always on one side. It's never on both sides.
Okay.
So a swollen leg on one side, you have to think DVT.
Anyone in particular at risk? Older folks, kids, men, women?
Yeah, that's a great question. It affects about 1 in 1,000, which means 300,000 to 500,000 people in this country are going to get it every year. But there are a couple subsets of people that do get them. The first subset is someone who has a tendency to form blood clots.
Okay.
5% of the population are born with inherited conditions that cause that. But beyond that, if you smoke, if you're over the age of 60, if you've had an operation, if you have varicose veins, if you've had trauma, if you're pregnant or you were pregnant, if you're overweight, and finally if you take any kind of estrogen supplements, that can increase the likelihood of you forming a clot. And the other category, Dan, are patients that are sedentary. We talked about needing the legs to move and pump the blood flow up. So long car ride, long plane ride, and what we really worry about are patients in the hospital, patients that are bedbound that don't move around. Those are the ones we really worried about.
And I want to get to that in just a minute for hospitalized patients, but for those people then that are going to be stuck in the car or on the plane for a long time, what can we do then to prevent this?
What can you do? Prevention is key. Well, there are a couple things. One thing you can do is try and recognize if you're at risk. Mom, dad, brothers, sisters, did anyone have a problem like this in the past? And if that's the case, get worked up. There's a blood test to see if you're at risk. Another thing you can do is change the things that you can change. If you're overweight, drop some weight. If you smoke, don't smoke. When you travel, if you're in a car, get out of the car every 2 hours. Get up and walk around. When you're in a plane, there are a few things you can do. We used to call this the economy class syndrome, meaning that if you're a guy like me that travels back in the back of the plane in economy, you're squished in like a sardine,
right,
you're likely to get it. But if you travel in the front of the plane where you can move around some more, you're less likely to get a clot. It hasn't been proven, so that really doesn't work. What you need to do is you need to get up and you need to walk around every 2 hours. And if you can't do that, while you're sitting in your seat, move your legs around every half hour. Don't cross your legs like this for extended periods of time. And when you're sitting, try not to let the back of your thighs hit the seat. Put a briefcase or something under your feet so it props them up a little bit.
So it's making your muscles work a little bit.
Exactly. And it takes the pressure off the veins. The last thing you can do is hydrate. Drink, drink, drink. Because the more you hydrate yourself, the faster the blood will flow through these veins. And paradoxically, it'll also make you have to get up and go to the bathroom, and that forces you to get up and walk.
A twofold benefit right there.
Yeah.
I want to quickly get to the prevention for hospital patients because that's a serious concern as well.
Sure. We've got different techniques that we use in the hospital. We have an arsenal, actually, of things that we can use. And what we use in our cardiac patients are a few that we have right here. The first thing we do is we get people up walking right away. I don't care if you had a heart surgery yesterday. You're going to get up and out of bed and walk the next day. That's critically important. We have compression stockings, and these are not garden variety compression stockings. These are stockings that have more pressure down at the level of the ankle, less pressure up top at the level of the calf.
So encouraging the blood to move back up to the heart.
Exactly, it squeezes it up. These are compression stockings that are filled with air. We have a machine that pumps air into these sort of bags that then tighten the leg. Do the exact same thing. The last thing we use, Dan, is a blood thinner. It's called heparin. It's something that we inject into our patients that thins the blood and that prevents the blood from clotting.
Okay. All right. Now, if a clot has formed, what can you do for treatment?
There are two particular things that we worry about as far as how we treat patients. And in order to understand that, you have to understand that one of the things we really worry about with these clots is that not so much what they do to the leg. Your leg becomes swollen, you're at risk for infection, ulcers. But occasionally, these clots in the leg can loosen up and they can travel in one unit up to the level of the heart. That's called a pulmonary embolus. Sometimes they're 1 inch long, sometimes they're 10 inches long.
Wow.
And once they get up to the heart, they can, for all intents and purposes, clog the machinery in your heart and lungs, and they can be fatal, just like David Bloom, the NBC correspondent several years ago. So we don't want that to happen. So our therapy around DVTs is twofold. Number one, we want to do something to get the clot burden less, to make the clot go away. The other thing that we want to do is to prevent this clot from traveling up to the lung. So the first thing we do is we give the patient blood thinners, not just the blood thinners that we give in the hospital, but a long-term blood thinner. You're going to be on, this is a pill called Coumadin you take every day for at least 3 months.
Okay.
That's the first line of therapy. The next line of therapy is actually to try to bust the clot open with what we call clot busters, these lytic agents. A vascular surgeon can introduce a catheter, much like this one, right into the vein where the clot is and deliver this solution that busts the clot open. And then he has other catheters that he can vacuum the clot out from. The last thing we have, Dan, is an ingenious device that's called an IVC filter. These don't really treat the clot, but they're placed in a main vein in the chest and abdomen above the clot, but below your heart, so that any clot that might break loose gets caught in the filter and doesn't go to your heart.
Fascinating. It's amazing. And a very, very serious threat, especially everyone's going to be traveling and spending a lot of time in the car, in the plane, things like that. So great information, Dr. Chris Magovern, for being with us today.
Great to be here.
Thanks.